Hello and welcome. My name is Kim Lombard. I am the Injury Prevention and Outreach Coordinator for Frederick Hospital. Today I'll be talking about how we utilize our electronic health records system to promote a community-based fall prevention program. And I'm happy to share our process and our results. A little bit of information about my healthcare system. I work for Frederick and the Medical College of Wisconsin. We are an adult level 1 trauma center. We are located in Milwaukee, Wisconsin. We do serve a large portion of the state, mostly the eastern side of our state. And when we talk about leading mechanisms of injury, the number one injury that we see at Frederick are falls. Across our enterprise, all of our hospitals, we do see about 600 patients every month in our emergency departments. For our trauma center, we're admitting 1,700 patients just in 2024. 70% of those individuals were ages 65 and older. We think about the large number of patients that we do see in 2024. Falls did account for 38% of all of our trauma-related hospitalizations. So it is an area that we certainly want to focus on when we think about prevention. Now, we have been facilitating an evidence-based program called Stepping On at Frederick since 2021. This is a program that we have grown. We are now providing it 4 to 5 times every year. We have a team of facilitators working to put out this program in our community. We do provide in-person workshops as well as virtual workshops. And a little bit of information about Stepping On. It is an evidence-based program, meaning that it is effective. We do see a 31% reduction in falls according to the research on this program, and we know that it works. We see people make changes throughout the program, changing their behavior, changing their environment, and really making some positive changes to prevent falls. All right, so let's talk a little bit about the problem that we had identified. We were questioning kind of our promotion strategies, if we were really doing things the right way, getting to the right people. We knew that we were seeing people that were being injured by falls, treating them every single day. However, many of our workshops were not being filled to capacity. Some of the strategies that we were using for promotion were posting flyers in the community, mailing flyers to individuals and certain groups. We were emailing staff every single time we had a workshop to encourage them to share this resource, this great program with their patients. We were doing things like community presentations. All of these strategies were very time consuming when we combined them all together, and quite costly when you consider the time it takes to do all of the promotion. So we really wanted to think about a smarter way, an easier way to do this work and to share about this great program. All right, so here in this table, we have some comparisons of people who had registered for the Stepping On workshop. That's the blue line, and then a comparison of the final number of workshop attendees in that orange line. Stepping On does recommend, or requires, I should say, a group size of 10 to 14 people attendees for in-person workshops. Our goal at Frederick Hospital is to stay on the top of that. So we want to have 14, we want a max class, each class, 14 participants, each workshop. If you compare, so our red line is kind of our goal. Here in that orange line, we really were well under that goal in 2024. Okay, so let's talk about our potential solution. We actually heard about this strategy from our partners, our colleagues over at Bellin and Gunderson Health. Shout out to Megan and Kelly. We were fortunate enough to hear about their great work, and we started investigating to see if we could replicate and bring a similar strategy to our health system. And this strategy involved using the electronic health record, otherwise known as, you might be familiar with MyChart or Epic, but using that system, that software system, to send messages directly about stepping on to perhaps patients that need it the most, patients that are at risk for falls. To break that down, the electronic health record is software, so it's used to securely store and share information about a patient's health care. EMR systems are kind of software programs like MyChart and Epic, where it's really easy for patients to communicate with their providers. They can use their tablet, their laptop to see all of their health information in a secured and safe spot. So the process that we took to see if we could get this messaging announcement approved, I first started with our patient education department. They led me to a group called the Outreach Strategy Team, which is a group that meets weekly at Freighter. That team consists of members from IT, health information management, digital health, operations, population health, and marketing. And so really all the right people that we needed right at the table. We proposed to them our messaging campaign using MyChart to reach our patients to promote stepping on. And we had a few meetings, few discussions, lots of emails within just a few month period. And some of the discussion involved like, how do we make sure we reach the right people? And so we agreed as a group to utilize our health risk assessment data. Every patient 65 years of older has access to a free annual wellness visit. This is part of their plan, and with that, they receive a health risk assessment. This is a questionnaire that they answer every year, and it's asking some questions related to falls. So if people are answering yes to at least one of those questions, are they worried about falling? Or have they fallen in the past year? And if they're age 60 and older, and if they have access to MyChart, that would qualify them for our messaging announcements. So we were approved for a 30-day announcement, which is located on the homepage of their MyChart. You can kind of see it right at the bottom right of your screen, the message is there. So we had a little bit of text, we had a button where they could click more. We also provided some information. So we were most excited just about being approved, and we were very excited about the how quickly and easy this whole process was. So in January of 2025, that's when we proposed the MyChart outreach promotion to that strategy team. We met with them through February, and the go live date, it only took us a few months to go live. March 12th, that message was released to the people that met that criteria for MyChart. So people started receiving those messages, and our phones blew up. We filled that spring workshop within 24 hours of our go live date. We filled our next workshop, which took place in the summer of this year, that filled within 1 week. So this table here, we can compare some of those promotional strategies. So the blue line represents strategies before we made that MyChart announcement. This data comes from the WIHA participant baseline survey, where they're asking the question, how did you hear about this program? So that blue line, prior to the MyChart campaign, people were hearing about it through brochures and posters, some through their healthcare provider. I can guarantee that's probably mostly our lovely physical therapists who are promoting the program. That orange line represents then the after the MyChart announcements went out. So 60% responding that they heard about it through their healthcare provider. We can kind of assume that was MyChart because of the timing and just how the course filled within 24 hours and within a week. The second highest is the other. So we don't know what people consider other. Okay, so this table then, it looks a little bit like the table we saw a few slides ago. I did add some additional information here. So now we can see the impact of that MyChart announcement. If you recall, the red line is our goal line. We want to reach that line. And then here in the orange is the final number of attendees. So we met that goal with that first workshop, a little bit under the goal with the second workshop. We have a workshop right now that has 15 people, so right around where we want to be and what we want to see for maximizing our resources and maximizing the number of people who are taking our Stepping On workshops. So overall, we feel very positive about this project. We feel that it was very successful. What we wanted to see, we saw. So we wanted an increase in registrations. We wanted to reach the right people. We wanted to create an effective strategy. We wanted to save time and not have to do all of the kind of the work to promote the program. So this was very cost effective. And we were able to kind of hit our mark and get the number of registrations and number of people that we want. Things to consider. If you choose to do this at your healthcare institution, definitely be prepared. Be prepared for a large influx of calls and inquiries. I'm fortunate at Freighter. We have many resources. We take registrations through our call center. We take registrations online. Um, but we probably could have, I think in the future, I would block my schedule. Even though I'm not taking registrations personally, I was getting a lot of calls, people inquiring about the program. My number was that number on, if you need questions, call this phone number. So in the future, I would probably block my schedule out just to make sure I can handle that influx, or I could find additional resources to help with that process. If you're also considering doing a project like this, have a plan. So you need to have a plan for that overfill. We offer multiple courses a year at Freighter, so we know that there's going to be more courses coming. You might need to establish a wait list. You might need to establish a way for you to refer people out. So using your partnerships, if there's other people, other organizations offering Stepping On in your community, it's important to communicate and kind of plan ahead with them. So just being prepared to have an influx of interest with such a large scale promotion would be helpful. So with that, thank you for listening. I appreciate your time today. If you do have questions, please reach out to me personally, kimberly.lombard@freighter.com. Thank you.